I mean, public health, it's like the stepchild of clinical medicine, Like nobody really knows we exist. And if we do our job right, nobody should know we exist. Um, but it's like one of those things like, yeah, I don't know if any of what I'm saying makes sense, but public
No,
health is to me like, keep going, go.
I was just gonna say, I love that you said that. If we do our job right, no one will know we exist, because when I first took my first public health class in college, one of the first things my professor taught us was that public health is measured in like survival. So it's like an invisible measurement, you'll never know. Like public health successes is just like life.
Welcome to the Public Health Millennial Career Stories podcast, episode number 15. Hi, everyone. My name is Omari Richards. Thank you for watching these episodes. I appreciate it. Well, I'm not going to talk too much today, but just make sure you subscribe. And this episode has a lot of information in it, a lot of great tips for a lot of different people. So just make sure you listen to the entire thing. I think the conversation with the two of these wonderful public health professionals is going to be very illuminating and help you in some aspect of your career or just life. So definitely listen and enjoy. This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Today's episode is going to be a little different, as I'll be having two guests, a duo of sorts. One of these two ladies is an epidemiologist for a Texas County Department of Health. Thank you for your work. While the other half of the duo is a PhD student in epidemiology at UT Health in Dallas, Texas, and a graduate research assistant. Together, they have completed their MPHs in epidemiology from the UT Health School of Public Health in 2019, as well as being the duo for the amazingly informative Instagram platform Donuts and Data. We have Mee-A, Keeton, MPH, and Sitara, Weerakoon, MPH, PhD student. Welcome to the show. How are you all doing today?
Thanks so much for having us. We're doing good. I'm doing good.
Yeah, doing great. Just hanging in there, waiting for the pandemic to pass.
Yeah, I can imagine. Yeah, but I'm really glad to have you all on the show, because I know like we connected through Instagram, I don't know, a couple months now, and it's definitely been great to see your platform grow alongside mine and just really develop like this public health and just the field on social media. I think needs to be seen more. So I really appreciate everything that you all are doing, and we can talk about that a little bit later on. Tell us about your personal backgrounds.
Oh goodness. My personal background's a little quirky. I mean, do we want to start with I was born in England. I'm, you know, part English, part Korean. I grew up in Houston, which is random of all places coming from England, and then went to A&M, which is primarily an agricultural school. And they're well known for their engineering program, and actually started college planning to go into chemical engineering because my dad was an engineer and I kind of wanted to follow that path. And then just realized that wasn't really something that really spoke to me. And then went into pure mathematics and graduated with a bachelor's in pure mathematics. So it's been a weird process getting to where I am right now, just because it's not, I think, the traditional path of somebody who typically plans to go into epidemiology.
Yeah, thank you.
And on the other hand, actually, well, not so different. I started, okay, I guess I'll start way at the beginning. I'm originally from Austin, Texas. I was born in Austin, Texas. And then when I went to college, I knew I wanted a small school. I knew I didn't want to be at like a big state school because I wanted more of like a classroom experience where you get to know your professors. So I went to a small liberal arts college. And when I got there, I kind of was all over the place. I took like an environmental health class. I took like just classes in every department, and I couldn't decide. I couldn't put my finger down on any specific major. I was interested in everything. And then just like, it was luck, pure luck. My school introduced a new major at the exact same time that I was supposed to declare, and the major was public health. And I looked at the course sheet for all the course requirements for this new public health degree, and all the random classes I had taken fit. So it's kind of like, this is my only choice. If you want to graduate, you have to declare this major, because you've taken it was like anthropology, sociology, like everything. So that's how I ended up in public health. I took my first public health, well, we'll get to that. But that's my background.
Okay, awesome. And what does public health mean to you all?
Public health, goodness, I feel like it's so loaded. You do have the typical sense that public health means aiding clinicians in implementing policies so that people will, really understand and take ownership of their own health. But at the same time, public health, it's like the stepchild of clinical medicine, like nobody really knows we exist. And if we do our job right, nobody should know we exist. But it's like one of those things, like, yeah, I don't know if any of what I'm saying makes sense, but public health is to me like, keep going, go.
I was just gonna say, I love that you said that. If we do our job right, no one will know we exist, because when I first took my first public health class in college, one of the first things my professor taught us was that public health is measured in like survival. So it's like an invisible measurement, you'll never know. Like, public health successes is just like life. Because we're like,
yeah.
So what I was going to say for my answer was, public health to me is preventative. It's a preventative approach. It's a preventative approach to health. And so, like Mee-A said, if we do our job right, we prevent all of these things from happening, and no one even knows. No one even knows that all of the lives that we've saved.
Yeah, absolutely. And I think that's a big thing too, because it is focused so much on prevention that it's hard to say, okay, this is what we're doing, because you don't see the after effects, like technically, because you are preventing the bad things from happening. So it is hard. And I like what Mee-A said. I think you said it was a bastard stepchild, and clinical bastard.
Yeah.
And that is absolutely true, because literally no one knows what public health is, but everyone knows what.
Before COVID, nobody knew what epidemiology was. Me and Sitara joke all the time that everybody would ask us if we were skin doctors, because they just did not know what epidemiology was. And I was like, appreciate that you think it does mean that I'm a skin doctor. Don't show me your mole. I don't want to see it. Like, public health, it's one of those things, like, it gave me an opportunity to help people in a way that didn't require me taking their blood. I always wanted to help people, on a larger scale. And at the beginning of my career, that looked like teaching and helping kids learn math. And I loved that. And then when I progressed to wanting to do something a little bit more healthcare related, I turned to epidemiology into public health, because, I got a chance to possibly impact a much larger community as a whole instead of one individual person.
Okay, and since you started going down that path, let's jump into your bachelor's degree, because you said you wanted to become a chemical engineer, and then you got your bachelor's degree in pure maths. So, like, just tell me, like, going forward, like, what did you really want to do with your undergrad?
That's a good question. I don't think I could have answered it then, and I don't think I can answer that now. It was one of those things of just blindly following what you enjoy. So for me, I loved the idea of chemical engineering because I loved chemistry and I loved math, but I didn't necessarily like applying those two things into an engineering aspect. So that kind of pushed me away from that career path. And I just really took to math in university. I loved it. I loved going through all of my undergrad courses and being able to find weird and wonderful things using numbers and just abstract theories, because, as you get further and further into pure mathematics, the less and less you'll see numbers. I mean, I remember there was a proof we were doing in a class where we ran out of Greek letters, we ran out of English letters, and so we started using Hebrew, and that was just like the next thing to use. And I was like, I think this is a sign maybe we should stop. But I mean, I love math. I don't think I had a clear-cut path at the time as to what I wanted to do with that. I knew with math there are so many different pathways you can go. You can go the actuarial route and work in risk and insurance, and that's not something I was interested in. You can go the statistical route, which I kind of ended up going in the long run, but at the time that was not what I was interested in, because in my mind I had this, idea that statistics meant that I was going to do some type of weird investment banking, and it just wasn't anything I wanted to do at all related to that. And so it kind of, using math towards epidemiology, it was introduced to me in undergrad, but in the weirdest way possible. I was doing a research seminar with one of the math professors that everybody loves at A&M, and he had talked to me and he was like, what do you want to do with your math degree? And I was like, I don't know. I mean, I got a PhD in math. I don't know what I'll do with that then. I mean, who does anything with a PhD in math? I guess I'll teach college. I don't know. And he asked me what else I was interested in. And I had told him I was really interested in infectious diseases and vector-borne diseases. And he happened to have a really close friend at the vet school. And A&M, while it is a very agricultural heavy school, it's also a very well-known vet school in Texas. So I lucked out in that I got to work at the vet school, and I got to meet an amazing professor who had a Lyme disease lab that let me, and they needed somebody who was good with numbers to kind of help them with their quantitative analysis. And so I was able to work with them. They introduced me to some biostatisticians and epidemiologists, and that's kind of how that went. I mean, I did teach for a little bit after I graduated, but I always came back to epidemiology because I thought about how much fun I had at that Lyme disease lab, just looking at ticks and analyzing stuff.
Okay, so to kind of ask you, so when you graduated, you did start teaching. Why did you not just jump into epidemiology right away?
I don't think I was ready for it. I don't think I was ready for epidemiology. I don't think I was ready for grad school. I had no ownership of what I was learning. I had no real drive to continue with school. And it really wasn't until, teaching for me, and this is going to sound bad, but I always just assumed I was going to teach. I grew up doing Taekwondo since I was 5. And I always helped teach after I got my black belt with my instructors. And so teaching for me was something that was introduced when I was really young. And I knew I was good at it because, one, I'm incredibly loud. So that kind of naturally lends yourself to being a teacher. And 2, I'm incredibly talkative. And so, again, lends yourself to being a teacher. And so it was just kind of what I assumed I was always going to do. And it wasn't until I started teaching and teaching my students not just math, but life skills about how to take ownership of the skills that you're learning and how to really incorporate the skills that we're learning. It doesn't have to be the quadratic formula, but the logic that you apply to that quadratic formula into other aspects of your life. That's when I decided that I was ready to really tackle grad school and make it something that I would actually benefit from, instead of being just an empty shell of a person who can read and reiterate information, but not actually have a passion for it.
Okay, yeah, that makes a lot of sense. Thank you for that. And let's change gears to Sitara now. So you were saying that you have your bachelor's in public health and French from Austin College, but you were saying that you didn't really know what you wanted to do. So going into college, what was your mindset?
It was all over the place. Fresh out of high school, I had just taken an AP psychology class and I loved it. And so I was kind of thinking, ooh, like psychiatrist. And then I also at the same time, like, I've always just loved teeth. And so at the time I was like, I was also like, maybe dentist, because I loved going to the dentist. Like all of my friends hated it. They all call me crazy. They're like, I don't understand why you enjoy going to the dentist. To this day, though, I had a great dentist and great dental hygienist. So credits to them for
You
making
know
my
what,
dental
Sitara?
experience.
You can touch my teeth anytime you want. After
What's
COVID.
What's so funny though is now I kind of hate teeth. It's like, I don't know. I always get grossed out by teeth, and my boyfriend's always like, how are you going to be a dentist? And I was like, I don't know. But so I went into college kind of thinking like the pre-med route, pre-dental, like pre-health route. And then at the same time, I started learning French when I was 10 years old because my mom learned French. Like she also took French when she was in college, and she always just like loved French. And so she kind of, and my sister, my older sister, she was raised in Luxembourg. Crazy under family does not make sense. So she and my mom, they both kind of just influenced this like love for French in me. And so I took French all from 6th grade all the way to high school every single year. And so when I went into college, I knew that I was going to continue that. And so the French major was kind of just a coincidence. It was like, oh, well, you've taken a French course every single semester, so you have a major. But yeah, so I was kind of going in that pre-health route, taking chemistry, biology, and I just was hating it. I was just absolutely not understanding what I was learning. I wasn't able to apply it. I didn't understand, it wasn't what I was passionate about. And I'm someone who needs to be studying in order to do well. I'm someone who has to love what I'm doing, which is why I was taking classes in all these other departments, because I was loving them and I was so passionate about them. And I just felt this huge contrast. Like I wasn't doing great in my like biology and chemistry classes, but I was like excelling in like globalization. So I knew that there was kind of a disconnect. Like maybe you shouldn't be going into something that you're not doing well in and you're not loving. And then, like I said earlier, I found public health, and then I took my first public health class, and everything just clicked. It was like, this is where I meant to be. Like I've always wanted to be in the health sciences, and this is exactly the place for me. Like I get this. I love this. I'm passionate about it. It was like so eye-opening for me. So that's kind of how I got into the public health world in undergrad, and then it just took off from there.
Okay, so what was it about that public health class that really made you say, okay, this is for me?
Honestly, I was so naive at the time. Like our professor just kind of was like, hey, seatbelt laws, that's public health. Like fluoride in water, that's public health. And I was like, oh, you know what? That makes sense. Like a preventative approach to health just makes so much more sense than what we currently do, especially in the United States. And I've always been kind of like politically active as well, like politically minded. So just kind of seeing how it all fit together with how like the US approaches certain things health wise, learning about preventative measures that public health has implemented, and kind of learning about how people resist those and how, I don't know. There is just a lot of things about public health, the preventative side, the preventative approach to it that just really clicked for me. And I knew that I wanted to be on like that side of everything, like that side of history, so to speak. Like I wanted to be part of that movement, the public health movement. So yeah.
Okay. Yeah, and I think I feel a similar way. Like going into my MPH program, I still wanted to be a doctor, but then after learning more about public health, I'm like, that system makes no sense. Like if I was in a different country, it might have been a different mindset. But just considering the amount of money that the US spends on the medical, like healthcare system, and just how poor the outcomes are, I was like, that does not make any sense.
Yeah.
But you touched on you were politically active. So during your undergrad, you were in Model UN, and you actually won a National Model United Nations Outstanding Delegation Award. So tell us about your Model UN experience.
Yeah. So Model UN was something I had done all throughout high school as well. Again, I'm all over the place with my passions, okay? I love everything. So in high school, and actually this honestly started in middle school. So I went to a law middle school. It was a middle school that they had a specific program for students interested in law and humanities. And that was the program that I was in. So straight off the bat, I was already kind of on like the social science side of everything. So when I got to high school, I learned about Model UN, which, in case anyone doesn't know, it's a program where students essentially role play. That's a horrible word for it. We pretend to be United Nations members. We're delegates. We represent countries. We meet, and you argue, you talk, and you make resolutions for all of these fake issues. They're not fake, they're real. And it's just a fun way for students to get that experience. So in high school, I did Model UN almost every year, and it was just for fun. It was, I guess, like to put on my resume, and it was just a really fun experience. I loved it. So I got to college, and I did it, and yeah, me and my partner, we killed it. We were like just a great duo, and yeah, we ended up winning best delegation from our class.
Okay, awesome. What nation were you?
We were Mexico, and we were in the United Nations Environment Program, UNEP. It was a lot of fun.
Yeah, I never took part in UN, Model UN, but I've heard a lot of good things, and I really, looking back, I really do wish I did take part because it looks like a lot of fun.
It was so fun. It's a great experience for high schoolers and college students, honestly. Like, it's just one of those bonding experiences that you go and you just intensively spend like all day with other people your age, which can be a disaster, but it's just so fun.
So going back to Mee-A now, what was the thought process behind you wanting to get an MPH? Like, why didn't you say, okay, let me just get a certificate in epidemiology or something of that sort instead of like getting a master's in public health?
I mean, if we're being completely honest, it was probably familial pressure. I mean, I come from a family that the bottom expectation is that you always get your bachelor's degree at a bare minimum. And, you know, my dad has always pushed me to go into a little bit more of a further education past getting a bachelor's degree, because he was very frank with me about it. And he told me that, you know, as everybody is getting their bachelor's degree, it's not going to cut it anymore. And if you really want to be competitive in what you want to do, you're going to need to get at least a master's. And so that's kind of the principle I've always lived by. If I was going to do something, I was going to do it well. I didn't want to go with a certificate because I knew through my undergrad experience with epidemiology that I would want to pursue it as a career. So as opposed to getting a certificate, I decided to go with a master's program because I really knew that it could immerse me in this whole public health experience. And I was lucky that Sitara and I's program really does take on a holistic view of public health instead of focusing strictly on epidemiology or strictly on biostatistics. We got a little bit of every piece of public health. I mean, that might not necessarily be my most favorite class in the world, but I still got a good chunk of knowledge of, you know, what it means to be in public policy or what it means to enact behavioral changes. And it gave me a good idea of not only just what epidemiology is on a clinical sense and in a research sense, it also gave me just overarching ideas of what specific sector of public health I would really, really want to target and focus on for my career. For me, that was social determinants of health. And that's something that I feel like only a master's program, and of course I'm biased, but for me, it's, you know, something that only a master's program can really deliver that experience to you.
Okay, thank you. And Sitara, what was the thought process for you?
Yeah, so so timeline in my life. I've declared my major, public health, and I'm looking for, you know, practical experience in public health. And I got an internship at a hospital in Austin. And the ladies that I was working with were just amazing. They were so inspirational, so hardworking, so down to earth, so much fun to work with. And they all had an MPH. And so they were just giving me career advice. And I had honest conversations with them about what my career path was at that point. And this kind of ties into why I'm getting my PhD, but at the time I didn't really know what I wanted with anything because like, as you can tell, I was up until that point kind of all over the place with my interests. But I knew I wanted to go to grad school didn't really know what I could do. And then when I learned about the MPH, or like the Master of Public Health, and I learned about what these women were doing and how they were applying it, I knew that that's what I wanted to do. I love that they were in a research setting. They worked with they worked with data. They also worked with children. They did, you know, interventions and studies, but they also had an office job where they could just, you know, write papers and run numbers and things. And I just really loved it. I loved that experience. I loved working with them. It was just, yeah. So they honestly, they were the ones who recommended that I pursue an MPH. And then at the time also, I was having a great experience with my professors at my college. And so teaching at a university was kind of also something I was thinking about. And so I knew that I would need a PhD. But at the time, I didn't really know enough about public health, didn't know enough about epidemiology, didn't know enough about the world, honestly, to go straight into a PhD program. So that's what ended up like making me decide to just do the master's and not apply directly into a PhD program, so that I could get my feet wet, learn about it a little bit, and then make that decision later on.
Okay, great, thank you. And when did you all meet in your MPH program?
This kind of throughout, right?
Yeah, this is such a funny question, because me and Mee-A we didn't know. We took, and well, we obviously knew, but we didn't know what that's, okay, that doesn't make any sense. We took a class called Intro to Data Science at some point in our program, and we were in the same group. We worked on the entire project the entire semester. We were in a group meet together the whole semester, didn't ever personally connect. And then the following semester, I believe, we also took our final epidemiology class, Epi 3. Again, didn't know we were in that class together. But then Mee-A shows up to my study group one day. And so that's the first time we're like physically together. And so I guess, I don't know, I mean, I remember, I remember that day. It was crazy. I remember knowing that Mee-A was a teacher, and I just remember thinking, God, she probably hates us right now.
Okay, so to preface this, UT Health has 5 different campuses throughout all of Texas. And throughout the majority of my master's program, I lived in Austin, and Sitara was living in Dallas. So we were on 2 separate regional campuses, but we were working together through either, you know, GroupMe or WhatsApp or any type of online interface. And so we actually never saw each other until that study group. And honestly, I did not think y'all were crazy. I loved you guys. I thought it was so much fun. Also, that was probably the most I learned in FE3 was that study group. So
yeah, so then Mee-A ended up getting a job at a lab at the Dallas campus. And then at that time, I was getting accepted into the PhD program at UT Health. And then I accepted, my mentor was the PI at this lab. So then a few months after we graduated, or like a month after we graduated, I show up to the lab. Finally, me and Mee-A are reunited.
Yes.
That's really awesome.
So it was a long journey.
It was a long time coming.
It was meant to be.
We ended up just realizing, yeah, seriously. I mean, after me and Sitara started talking, we realized how much we had in common. It was insane. It was like how, I mean, it's just weird how much we have in common. Like, weird how much we have in common.
Okay. Well, thank you for sharing that. And since Sitara brought it up, Mee-A was working at, you said, I can't remember what you said, but you're working on campus. What was that role, and how did you get it, and what did you learn from it?
Okay, well, so moving from Austin to Dallas, that move was prompted by my husband actually getting his dream job in Dallas. And so naturally I had to go job hunting because we were in a whole new city and I had no new connections. And so I was lucky enough to get this job at this lab at UT Health, and they worked primarily on obesity research. And I mean, a small subsection of obesity research that really focuses on those morbidly obese patients that are looking to pursue bariatric surgery. And so I got the job honestly through just searching through a bunch of research jobs and seeing which one sounded the coolest. And this one was one of the coolest sounding research labs. And I was really lucky to get an interview and get accepted for the job. And so I worked as a research assistant for about a year, a little over a year, until COVID hit. And my passion has always been, like I said earlier, my passion has always been infectious diseases and vector-borne diseases in the public health sector. And so with COVID-19 starting up at the beginning of the year, naturally I was morbidly geeking out over the pandemic because, from an infectious disease standpoint, it's absolutely fascinating. Everything about it is so interesting, and every piece of information that you get changes day to day. And so it is something it's really fun to be a part of. It's also very stressful and sad to be a part of. Also, we naturally never want a pandemic, but it did give me an opportunity to move on from my public health lab to a public sector where I could then help the county government work through public health and infection prevention measures as an epidemiologist. So that is what I'm doing now. I'm getting to work as an epidemiologist at a county level and work with all of these wonderful people in our county and help them battle COVID-19.
Okay, thank you. And I would like to talk about that a little bit more later on. So I was looking at, I think it's your LinkedIn profile, and it said that you did SQL. Is that something that you learned in your MPH classes? And what is SQL?
So SQL is I don't want to say it's a coding language because it's something that's a little bit easier to learn than your typical coding or programming language that you would compare it to, like C++ or something like that. It's like a pseudocode almost, and you use it when you work with SQL Server, which is something that's powered by Microsoft. And it's great for cleaning data. It's great for managing databases. And we're talking databases that are like large, thousands and thousands of different pieces of information that you're working with and cleaning and manipulating. And so that's not actually something I did learn from my MPH program. It's something I wish I learned from my MPH program, but it's something I learned from an internship that I got while at my MPH program, and had nothing to do with public health. It actually had to do with the teacher retirement system of Texas. And we were working on migrating data from one database to another database and making sure that the data that we were transferring over was properly transferring over. We wanted to make sure that if somebody said their retirement account had X amount of dollars, that when we moved it over to the new system, it still said that they had X amount of dollars and not X amount minus 3,000 or something like that. So we were using SQL to properly make sure, or to properly monitor that the data was migrating correctly.
Okay, thank you for that. I also saw that you were a data visualization at DataPick. Is that the job title, data visualization?
So that actually came about. Yes, it's data visualization. It's a fancy word for like a scientific graphic designer. You're getting to take data and make it look pretty. And I think data visualization nowadays, probably most people know about it through the Instagram account Info is Beautiful, because they have done some amazing work on COVID-19 data and how it affects certain ethnicities over other ethnicities, and how it affects certain age groups and genders over others. And so they were able to take all of this data, which, honestly, data, as much as I love it, it's not cute. It's not pretty. It's a bunch of numbers that if you stare at for too long, you get a migraine. And so data visualization is the process of which you take this ugly looking data and make it look really pretty so that everybody can access it and everybody enjoys looking at it.
Okay, thank you for sharing that. So
Yeah.
jumping back to Sitara, during your collegiate career, I seen that you've gotten a lot of scholarships. So is that something that you actively looked for, or is that something that just kind of like came your way?
No, yeah. So applied for all of those. That was me going out and finding them. But a lot of or some of them, I don't know, maybe like two or three or four, were from my school. And so our art school, um, they make it really, really easy for students to apply for scholarships. They list all of the scholarships on a web page. It's one application. You just check off all the scholarships you want. You write like one essay, you get one letter of rec, and then you just submit it to them. And then the scholarships that you've checked off, they submit those to those committees, and then the committees decide. So our school makes it so easy for students to apply for scholarships. I can't speak about other schools, but I've been really, really, really lucky in that regard, because yeah, finding scholarships can be so hard, so difficult, so stressful, because you apply for scholarships, you never hear back. I remember like in undergrad trying to find scholarships, and like I wouldn't even know if this was like a real website. It's just like, yeah. So that's how I got those. Some of them were experiences that I would do, like a conference. And for the conference, I would also apply for some scholarships, and then the conference would give you those awards. But yeah, so I would say, if any, Fred, like I guess advice for any students is, I'm sure your school does something for you in regards to financial assistance. And so definitely check with your school to see how they help you out with that.
Okay, yeah, thank you for sharing. That's really awesome that they have one application to do all those different scholarships. I feel like every school should
Oh
be
yeah.
doing that to make it easy for all students. But I guess that's a
Yes.
topic for discussion some other time. So, although Mia was a teacher, a math teacher, I see that Sitara did some teaching also, and I counted up, and you taught 146 students biostatistics. So I know biostats is
Yeah.
definitely not a favorite class for a lot of people. So what was your biggest challenge teaching?
Yeah. So this is a really good question. Honestly, you got it. Biostats is not a favorite subject for a lot of people, and it wasn't my favorite either. And really, what I wanted when I went into being a TA was, I wanted teaching experience, because, like I mentioned earlier, being a professor was something I was interested in. And so I wanted to get a little bit of that experience. So the biggest challenge for me was being able to know the information well enough to explain it to someone else. I mean, like, on paper, I was making A's, but I felt like I just kind of knew the basics. I felt like I could just know enough to do well on the exam. But if a student asked me like, "Hey, why, like what is the reason behind this formula?" I'd be like, "I don't know." It's a really good question. So for me, that was the biggest challenge, was taking that extra step further and actually finding out why certain things were the way they were. You know, it was like, even though I knew the formula, like for example, I knew the formula for a chi-square, it was like I need to know it well enough to just be able to, when someone shows me their question, be like, oh, that's a chi-square. That, like, it's like, looking back now, obviously that it's second nature to me. So that seems like, obviously that's a chi-square. This probably isn't making sense. But at the time, that was the biggest struggle for me, was being able to just look at a question and identify exactly how to help them, because sometimes I would need to take a few moments to look up the question, look up the type of data. There's just so many different tests out there, non-parametric tests and parametric tests, and like, it was just getting all of that, getting to a level where I could teach someone that. And I was a student at the time as well, so it was kind of me learning alongside the students. And now I could do it, but at the time it was pretty hard.
Okay, yeah, and definitely I've heard a lot, like teaching just reinforces what you know and really solidifies why people ask these like questions that you mightn't think of
Yeah.
by yourself, and it really helps you to dig in. So was that kind of process something that really motivated you to want to pursue a PhD, or is that a completely independent kind of thought feeling?
So what motivated me to get a PhD was, I mentioned this earlier, was how great of a relationship that I had with my professors in college. Not even just relationship, but how great of an experience I had. They were so, and again, I know 100% it's because I was at a small school. And like there was only like 20 people in a class or whatever. And so I wanted to be able to like emulate that and give to future students what my professors and what my teachers in like high school gave to me. And so that was my main motivating factor for getting a PhD, was knowing in the long run that I could eventually be a professor. And so, yeah, I don't know. Does that answer your question?
Yeah, it does. So
Okay.
you're doing a PhD in epidemiology, and it says that your minor is in biostats, breath, maternal, and child health. What does that mean?
Yeah, so at our school, for a PhD, you have to have one major, and that's any of the five, I think, departments like management, policy, health promotion. Yeah. So mine is epi, and then you have to have at least one minor. And again, that minor has to be from one of the main departments. So health promotion, environmental, yeah, policy. And then you have to have at least one other minor or a breath. And then the breaths are like maternal and child health, just like things that aren't a minor.
So kind of like
But
a
yeah, so
tract.
basically, kind of like, yeah, kind of like that. So you have to have at least, like, you have to have one minor, and you can either have two minors or one minor and one breath. So I knew that I wanted to go into child health because of that experience that I had in college with those women at that hospital. It was a children's hospital, and so I knew that pediatric epi was something that I wanted to pursue. And so that's just something I've been doing the whole time, is child health.
Okay, thank you. And one last question before we switch it over to Mia. So I see that you were the ambassador for UT Health at Universidad El Bosque, Bogota, Colombia. What was this?
This was a really fun global health experience that I just kind of spur of the moment was like, you know what, I'm going to do it. It doesn't really have anything to do with my like interests. It had nothing to do with child health or biostatistics, but it was just a fun experience for UT Health students to travel to Bogota. And then, so there's a faculty at UT Health that has a dual like position at this university in Bogota. And so he, opens up a few positions for some, or a few spots for some students to go to his lab and work in his lab, and also just kind of explore public health in another setting. And so it was like a little bit less than 2 week experience where we just visited like the Colombian version of the NIH. We visited like different labs there, and it was just really fun to learn about global health, how other countries handle public health. I learned a lot just about healthcare and just, fun stuff.
Okay, yeah, thank you. So now switching over to Mia. If I may ask, why didn't you want to pursue a PhD in epidemiology? Why was the MPH in epidemiology just enough for you?
Because for me, a PhD wasn't going to get me any further in my career track than an MPH was. And for me, I've always known that I wanted to pursue some type of governmental setting in public health. So that would either be through the federal government or the state government or the county government. And all three of which, while getting a PhD will never hurt you, getting a master's degree will get you just as far. And so for me, being the impatient person that I am, I got my master's degree and I was just super anxious to get started in my career. And I felt, in my personal opinion, and I know it's not the most popular opinion, but in my personal opinion, having a master's degree and then using those years that instead of dedicating those years towards a PhD, dedicating those years towards practice in the setting that I wanted to build my career in was actually going to be more beneficial for me.
Okay, thank you. And that makes
I
sense.
do want to add, I was in the same boat as Mee-A. The pretty much the only driving factor for a PhD for me was the potential to work in an academic setting as a professor. And so this I don't speak for everybody, but I do think people should think really long and hard about if the PhD is really for them, because in a lot of times it's not. A lot of times it's not necessary. You spend a lot of time and money doing something that will just make you overqualified. I just think that, like she said, a master's degree is enough for a lot of positions. And the experience that you get working as soon as you graduate is way more valuable than staying in school for like much longer. And so again, like, I'm here in this PhD program, and it's still because I want to be a professor. If I didn't want to do that, if I knew for sure that a professor was not something I wanted to pursue, I would not have done this. And I just want to like say that for anyone listening.
Yeah, and I appreciate you jumping in there. Thank you for sharing that. So, Mee-A, why did you want to switch to a county health department, public health department, to work as an epidemiologist?
So field epi, I mean, it's exactly as it sounds, I mean, field epi means that you get to be in the field. You get to, I may not necessarily be the person swabbing every single person in the county, but I'm getting to see the data and make changes and help implement policies that are going to be directly affecting the people around me. And so just due to the fact that, again, I'm just a very impatient person that likes to see results very quickly, and I like to see results in front of me, it's nice being in a county health department and being able to see the changes that you've helped implement come into effect right before your eyes. And that's something that, unfortunately, research, you don't really often get to see, because research is hard. I mean, it takes years and years and years and time and effort, and it doesn't necessarily mean that you're going to get to implement change. Whereas in a county, state, or federal health department, you get the opportunity to not only look at data that's in front of you that pertains to the people around you, but you get to implement changes that you can see right in front of you, which is, it's really satisfying.
Yeah, I could imagine. That definitely probably makes work a lot very meaningful. So, what kind of things do you do in day-to-day life as a field epidemiologist?
Well, it's COVID-19 right now, so my day-to-day changes day to day. So to give a general overview, let's see. I'm contact tracing on the individual level. I'm contact tracing at a facility or an outbreak level. I'm aiding in outbreak investigations when it comes to childcare centers and workplace outbreaks. I'm helping implement infection control measures in those outbreaks to help contain them. I'm doing little things here and there, like fine-tuning REDCap and Qualtrics and our other survey-based softwares. I'm helping clean data. I'm doing things here and there like address verification, just making sure that the lab results that we get in the thousands when we get a data dump from these drive-by or drive-through facilities, like I'll do address verification for a couple of hours, just making sure that those people actually do live in our county. And if they don't live in our county, we, fax them off to the appropriate county or state department. Right now, actually, I'm on call. And so that means that I have a janky small telephone that rings at all hours of the night. And it could be anybody from the general public being like, help, I have a neighbor 5 doors down that has COVID. What do I do? And I have to help, explain, the best measures or, best preventative measures. Or it might be a physician calling about COVID or not about COVID. And that's actually the most terrifying, is when I do get a call from a physician and it's not COVID, because we're in this bubble of COVID-19 right now that it's so easy to forget that other infectious diseases exist. And, we'll get a call about, something random like hepatitis A. And I have to really sit there for a moment and be like, okay, thank you for reporting hepatitis A. What do I do with that again? What's the right protocol? Like, do I just stand there and smile? Like, that's not a smiling matter. Like, what should I do? What should I say? Who should I get this information to? Honestly, my reoccurring nightmare right now is getting a call on the on-call phone about a physician reporting baby botulism, because I'm terrified of that. As an illness itself, it's terrifying. But then from an epidemiology standpoint, it's also terrifying because it can happen at all hours of the night. And I have to be ready at a moment's notice to call somebody so that they can get the toxin sent, or the appropriate antitoxin sent over, and all this stuff. And it's a reoccurring nightmare for me, because I'm like, what if I don't do it right and the baby isn't okay? And so it's a little bit of everything right now. I'm not gonna lie. A lot of stuff, a lot of, small counseling sessions in my office with my coworkers when they ask me when COVID's ending, and I'm like, I don't know. We don't know. It's never gonna end. Nobody's wearing a mask. Why won't they listen to us? And so, it's a little bit of crying here and there also in my day-to-day life. So, it's interesting. Every day is different.
Well, I appreciate you staying strong and doing all that you're doing to help us all. So thank you for that.
My pleasure.
So you spoke about facility COVID contact tracing. Explain what does that mean?
So when you contact trace somebody for COVID-19, because most people hopefully will be contact tracing, regardless of what county or what state you live in. Texas does count COVID-19 as a reportable condition, which means that we always get the positive cases reported to us either via fax or some kind of secure email. And we will go and we'll call them. We'll ask them about where they've been and who they've been around during the time that they were contagious. And we try to identify where they were exposed or who exposed them to COVID-19. And so that's pretty straightforward on an individual level. But with an outbreak, like a workplace outbreak or a long-term care facility outbreak, or any outbreak that stems from a congregate setting, it's going to be a little bit more difficult, because you're dealing with a lot of people who have to balance caring about their employees or their residents, or whoever they're in charge of. They have to care about their health, but then they also have to care about their bottom line. And so it's this back and forth between what is right and what is feasible. And so, we usually get a facility outbreak because we have gotten a positive case that we've contact traced that says, I've only ever been from work to home and home to work, and that's it since COVID started, and I live by myself. Well, then there's really only one other option as to where you might have gotten COVID-19 from, and that's probably the workplace. So we ask them about their workplace. We'll ask them, okay, tell me about your work. Are you in, it's typically a warehouse setting, where not where management might not provide masking, or where social distancing is not necessarily feasible. And so we'll ask them about their workplace. We'll ask them if it's okay if we can get the contact information from their workplace. And of course, we ensure that we will not tell their employer that they reported them. It's all going to be anonymous, because otherwise, even though we have laws in place to protect employees, that doesn't necessarily always get carried out. And so we will go and we'll call the employer and we'll say, hey, I was notified that there were some possible COVID-19 cases throughout your facility, and I just wanted to see if you have any infection prevention measures in place? And if not, I would love to talk to you about implementing some. And so it's really just making sure that you're the nicest and most politically correct person in this setting, you know, and trying to not reprimand any employer about not implementing infection prevention measures, because a lot of the times it's not their fault. They don't know. I mean, none of us know. COVID-19 is weird. And like, it just changes every day. 2020 in general is weird. So, I mean, we can't really blame any facility for having an outbreak, because they just don't know. And so we just talk to them and we talk about what we've seen works with other facilities and what we've seen the CDC has recommended. And so, you know, asking them, you know, you can tell somebody to stay 6 feet away from each other, but that doesn't always happen. And people don't always remember or can gauge where 6 feet is. So having visual markers in place, or if it's not feasible, having something like a face shield or a physical barrier that could protect them. Do you have hand washing stations, hand sanitizer stations? Do you allow them to congregate in the break room? How does clocking in look? Do they all clock in at the same time in a small area, or do you get to stagger their shifts? It's all stuff like that we talk through. We ask them about screening procedures also. And most of the time, we're really lucky that the facilities we work with are so open to these suggestions, and they work their best to make sure that they can control this infection, because in the long run, implementing these small little changes is a lot cheaper to them than having to shut down their entire facility because everybody has COVID and they had to go home.
Yeah, and that absolutely makes sense. And thank you for sharing all of that. So what is most exciting and least exciting in your role?
Oh my goodness. Okay, most exciting, this is going to sound bad, but most exciting is when we get somebody who is either argumentative and they're pushing back on CDC guidance, or if they're trying to lie and say they don't have COVID-19 or they're actively trying to transmit it. Okay, that is my jam, because I love being able to find a way to stop them. It's like my own personal, like if you're not going to follow CDC guidance, then fine, I'm going to get you, you know, not in like the meanest way possible, but I'm going to find you, I'm going to get you, I'm going to make sure that you adhere to these guidelines because you are not special. And so that's probably the most exciting, is whenever, you know, we'll get like a report that's like, this person, I know they have COVID-19 and they're refusing to stay at home and self-isolate and they're just going out without a mask on. And I'll be like, don't worry, I'm on it. I'll do what I can. I'll save the world. Like, that's my, like, me pretending to be a superhero. I'm like, my superpower is citing CDC guidance. But, you know, it's like, that is the highlight of my days when I have something like that, where I'm like, okay, let's get it done. But I mean, yeah, it's super fun. And I guess the least exciting thing about my role would be, oh goodness, the least exciting might be the clerical aspect of it, just because, you know, I like to make sure, because I'm an organization freak and I'm a record keeping freak, I like to have electronic records and paper records of absolutely everything, so that I know for some reason if I've misplaced a paper, I have the electronic copy. But that's a tedious thing to do. But then on the other side of it, I guess, not the least interesting thing, but like the most depressing thing has to be dealing with deaths and getting the death reports. And then they usually have some kind of story, or some kind of story behind the death. And that's always really, really hard to hear and read, because, I mean, even though death is obviously an inevitable thing, it's always hard to deal with, even if you don't know the person. And I'm a very emotional person. Sitara can tell you that, I mean, a stiff breeze will make me cry. And so reading these death records, I'm over there a snotty, cryy mess, and I'm like, I mean, it wasn't his time, no. And like, yeah. And then my coworkers all think that I'm crazy because I cry and I'm blotchy, and they're like, I mean, the person was 100. So, and they had underlying conditions, and I'll be like, but it just wasn't their time. And so, that's definitely the hardest part of my job, is having to deal with the downside of COVID-19, and seeing how it can really impact families because they lose their loved ones, and it sucks.
Yeah, and
Sorry to end on a sad note.
no, you're fine, and you're absolutely a superhero. Do not let anyone tell you otherwise. So thank you for your hard superhero work out there, and you keep calling that people and keep spreading those CDC guidelines.
Oh, I will cite every ounce of that CDC guideline.
Okay, awesome. So before I ask the same question to Sitara, you said a little earlier that you really wanted to get your PhD because you know that you wanted to become a professor. So what made you want to become a professor?
Yeah, so I mean, teaching to me, I've never really been a teacher. I have a lot of friends that have always wanted to be teachers, became teachers, and are just so good at it. And I'm really not the best teacher. I'm not a very eloquent person. I don't really make sense a lot of the time when I talk. But I've always had such great teachers in my life. Like, my teachers have just, every single one, I've never had a bad teacher. I don't know if I'm just really lucky, but I've always just had amazing teachers. And when I went to college, it continued. Every single professor I had was just so nice, so welcoming, so just, I guess welcoming is the best word. Their office hours were open, their door was open. I would spend hours in my professors' offices just talking about, different issues that came up in class, like different topics. And that's what I wanted to do. And then also, I had a public health class I took in college. I just kind of saw myself in my professor. She was a small brown lady. And I just kind of was like, I could totally see myself doing this. She's such an inspiration to me. It's so crazy when people talk about representation and like diversity. I'm like, oh yeah, diversity is great. But when you actually see yourself in someone that's like above you, it's actually kind of life changing, because you're kind of like, oh wow, I could do that. And I think I want to say that was probably my first brown teacher. I could be wrong. I think so. And so I think maybe that was the point where I was like, wait a second, like, I love this subject. I could see myself knowing the subject back and forth, or like the back of my hand. Like, I could see myself just knowing everything there is to know about the subject and doing what she does. And so I think that was the moment that I was like, I kind of want to do this. I think I could do this well. And then, yeah, so that's kind of what drove me to be a professor, is also just this desire to constantly be learning, because that's what professors do. They're always learning. And I'm such a nerdy little student. I love being a student. And so professor is like the perfect, like, permanent student.
Yeah. And to build off of that, I mean, I do want to reiterate what Sitara said about representation, because it's something that is so important. I actually have never had an Asian female boss until now. And having an employer and a mentor that I can see myself in has really fueled me every day that I go into work, because one, can see myself one day becoming close to her. I mean, I don't know if I could ever reach her level of badassery, but just the idea that I could even have just a modicum of her coolness, her amazingness, her knowledge is so inspiring to me that it pushes me to work every day. I mean, we don't have the luxury of having every weekend off, or having the regular 8-hour shift, and it's never bothered me, because I always go into work knowing that, one, I'm going to have an amazing time just doing the work that I'm doing and interacting with my coworkers, but having an employer that really does push us to constantly strive to be better, and me being able to see myself in her through that representation, is just so important. I really do think it makes a massive difference.
Yeah, and I 100% agree with that. And it definitely does say something for just seeing yourself and wanting to say, oh, I can do that. Or oh, they did that. Oh, and it also helps because, you know, these people had certain experiences that are similar to yours, and they can probably talk to you about those kinds of things, and you can go through those challenges together.
And
So
just, yeah,
mhm.
and just knowing that, oh, sorry.
No, you go ahead, please. This is a show about
I
you.
was just gonna say, well, no, I was just gonna say, like, just knowing that all the internalized like struggles that we have, just knowing that that person probably felt the same way, you know, all of the like little struggles that each one of us uniquely goes through, seeing someone that looks like you're like, well, they probably were insecure about XYZ and they made it through that. So
Yeah,
yeah.
definitely. Yeah, thank you for sharing that. So another part of PhD programs is definitely like the dissertation. So have you decided on your topic for your dissertation, and what was your process deciding on that, if you can talk about it?
Yeah, I have I'll talk about it a little bit in an abstract way. I have, but I think my situation is a little unique because the way that it came about was my professor already had this data. And so it was kind of like, hey, you're interested in this. I have this data. When the time comes, do you want to use it? And so it was like kind of a planned way ahead of time. I didn't need to have it planned out at the time that I did, but I was able to because of my interests. But in a typical timeline, I wouldn't be deciding that until like in a few months. Um, so yeah, so in my situation, it's already planned out. I obviously have to like do all of the data cleaning and like the actual dissertation, but the question is written out. And so yeah.
Okay, thank you. Um, hmm. So I guess I can ask you the same question. So what is your most exciting and least exciting part about being a PhD student?
I would say the most exciting for me is the fact that I do get to learn every single day. And I feel like I could physically grasp how much I have learned in the past 3 years. Like when I think about the things that I'm learning today, just it blows my mind that I like how far I've come from undergrad. Because when I was an undergrad, I was a public health major and I was learning all these public health things. And I was like, oh, wow, I know everything there is to know about public health and epidemiology. But now I'm still learning. Like I'm still learning so much and I'm still learning something new every single day. And so that's definitely my favorite part, is the fact that I'm constantly learning. My least favorite part would probably be maybe just the constant feeling of like imposter syndrome, feeling like I'm not good enough, feeling like I won't be good enough or I won't know as much as I need to. Or on the other hand of learning every day, it's also at the same time, it's not knowing things every day and learning them. So my favorite part is learning. My least favorite part is the fact that there is so much more that I still don't know. And I do still have a lot to learn, but it can kind of feel overwhelming at times, like just how much I don't know or how much I feel like I don't know, even if I might know. So imposter syndrome would be the best way to explain that.
Yeah, thank you, and thank you for humanizing yourself once again, because I think that it's something that people like when you look at someone that is further along in their career or in their PhD program, you're like, oh, they got everything figured out. But it's interesting that we all deal with these same questions. Oh, am I good enough? Oh, am I doing this right? And those kinds of things. So I think definitely sharing that you feel that way helps others to understand, like, oh, I'm not alone. Oh, other people who I think are successful are going through the same kinds of things. So it's okay if I am too. So thank you so much for sharing that. So changing gears completely. So you all have this Instagram platform, Donuts and Data, and it was recently your 1 year anniversary. So congratulations on that. So where did this idea come from? And
Man, donuts
before
and data.
drop the hashtag for donuts and not the well, not the hashtag, the handle for Donuts and Data, please and thank you.
I guess we can start with what started our idea to create Donuts and Data. So, you know, Sitara and I talk about how we're both pretty heavy in social media, as most of us, you know, millennials are, and we we were just struggling with the lack of representation that we saw with our field within the Instagram community. So, you know, for a lot of our fellow coworkers that are in the medical field that are wanting to be clinicians, so they're either pursuing their MD, their DO, their DNP, their, you know, any other type of clinician credential, there's always an Instagram account or an Instagram influencer that they can follow that, you know, they could label as their gold standard or their role model for, you know, becoming a doctor or a dermatologist or a plastic surgeon or a family nurse practitioner. And you get to see that whole process kind of documented throughout. And so you know what a day in the life looks like for them. You know, walking into, you know, if you decide to pursue getting your, you want to get in, you know, when, because of these Instagram accounts, you know what it's going to look like, not only during school and during your exams, but after school, getting a job, what that looks like, what your day-to-day looks like, the struggles and the perks that come with that job. But nobody knew about public health in general. I mean, not just epidemiology, but truly just what in the world is public health. And honestly, before COVID-19, you know, people would ask my husband what I would do, and he would say, she does something with statistics and like health, I guess. And they were like, oh, that's cool. Yeah, right. I get that. And I was like, you don't get that. Don't lie. And so we wanted to create this kind of like resource that people could look at and understand. And so when they do decide to pursue public health or epidemiology, they would know what it looks like from, you know, from the beginning, from getting your MPH to getting your PhD to what it looks like after you finish your education. What does it look like day to day? And I mean, it is kind of difficult because there is so much you can do with a public health degree, but we're trying our best to cover what we can, you know, so that people do know what it looks like every day and what it entails and what the perks are and what the downsides are for public health, because we want people to have that resource.
And then
Sitara,
also,
do you want to talk about donuts and data? Oh, sorry, go.
Oh, no, I was just going to say also just like the grad school journey, the public health grad school journey, because that was something we both had in common and could like talk about on our own experiences. And that was something that also we didn't see very much representation for on Instagram, was like, how do I get into grad school? What is public health? What is an MPH? What do you do? So, but yeah, wait, so hang on. So the handle is donuts spelled the fancy way. So it's DOUGHNUTS_and_data. And we wanted to do it fancy because, I don't know,
we're a little bougie like that. We like to be a little extra.
Yeah.
You know, I know we it was a debate. I mean, let's not make light of this. It was a long debate about donuts spelled DONUTS or donuts spelled with the U. And we were like, oh, I don't know. I mean, there's a certain finesse with the U and the G and the H, but nobody spells it like that. And we were like, oh, I don't know. And it was a hardcore debate. And then we wanted something that had alliteration in it because we're nerds and we like that.
We were like, I remember we were like, what public health term starts with a D? And we could not think of anything. We could not, we literally sat there for like nothing. And then we ran over to our PI boss and we were like, hey, any words that start with D that are like epi related or public health related? And she was like, I don't know. I'll think of something. We go back to our desks. We're sitting there. Like an hour later, she randomly shouts out, data. And we were like, what? And she was like, a D word that's public health related, data. So that's how it was born.
Yeah. Okay, awesome.
Yeah,
so,
because we wanted something that we both loved. And donuts, obviously, I mean, who can't love donuts? Like, it's amazing. You can't not love donuts. So it's kind of what we went with.
yeah, absolutely. So definitely go check out that Instagram profile, everyone. So was this started before you graduated with your MPHs? Like, I guess the mindset behind it.
I mean, I don't. Go
I
ahead.
guess the mindset behind it, our when we discussed it, it was before we both graduated, but we didn't really start it until after Sitara came back from the world's longest vacation all over the world. And I had settled in Dallas, so that was after we had both graduated.
Okay, and what kind of made you solidify that you wanted to do this and you wanted to have this Instagram presence and build this platform?
I guess we just thought that it would be fun for the both of us. We mostly were just like, hey, it's an excuse to go eat donuts all the time. At first we were just like, you know what? Let's go get donuts right now and make our first post. But I think, yeah, it was just something that we both, since we both are on social media, we both kind of knew, and we both followed influencers. We both kind of knew how to like, I don't want to say we know how to be influencers, but we we knew that it was something that we could both do and have fun with. And so once we started posting and getting all these fun ideas for different public health, epi related things, it kind of kicked off. We got a bunch of followers pretty quickly. And I think we knew at that point, like, you know, this is something we can continue.
And I do want to preface that, like, Sitara and I didn't make this account to be the stereotypical lifestyle influencer where we go over our skincare routine and everybody tries to emulate that. And, you know, we ask you to buy the shortest shorts in the world using our promo code. Like, it all goes back to that conversation we had a little bit earlier about representation. We wanted to be able to provide the representation that we didn't have.
Yeah. And I think also
because
something we've talked about. Going. I was just gonna say something we've talked about is like specifically we don't want to be those perfect influencers that their feed is just it all matches and they just have this perfect life, and like that to me is just awful. I hate it. I hate it. I don't like getting on Instagram and looking at all these people with these like little aesthetic photos because it's not real life. And so something we wanted to highlight is the real life of being in public health. Like it's not about us personally. It's not our personal life. It's just what is public health? What is epidemiology? What is real life? What is going to work like? We want it to be like, this sounds cheesy, but like as real as possible because that's what Instagram needs more of.
Yeah, I agree. I think we both struggle, and I think not both of us, I think all of us, I mean, everybody on social media struggles with comparing yourself, you know, I mean, no matter how resilient you are mentally, it's so difficult to see day after day after day of these beautiful, amazing people that are so accomplished. And I mean, to go back on what Sitara was saying about imposter syndrome, I have to remind myself every day that I'm just as qualified as my coworkers, and I have the capability to do just as much as they do and learn just as much as they do. I just have to give myself a little bit of credit. And I think a lot of that imposter syndrome and that self-doubt that I have kind of stems from all of these perfect people that I see all the time. And I mean, I think it shows that people do want something a little real, because one of our most liked posts was us with no makeup on, with like 3 hours of sleep, and I was desperately clinging to a cup of coffee like my life physically depended on it, because it did. And I think people realize, like, oh my god, like, same girl, same. And it was nice to be able to see that support and realize, like, okay, so everybody's on the same boat. We're all sleep deprived, we're all clinging to caffeine like it's our last hope, you know. We're trying to make it relatable.
Yeah, and I like that a lot, and it definitely helps for people to resonate with those sorts of things. And as both of you said, that like there are so many accounts out there for like medicine and pre-med journey, and like when I started my account, which is around the same time that you all started your account, there was literally no one talking. There were probably like three or like huge influencers talking about like public health, and like over the last, I want to say 3 months, the amount of accounts talking about public health has increased a lot. But I'm really glad that we were able to get in there a little bit before everyone else and really like try to build our brand. And I think it's something that is going to continue to grow, like getting more Instagram accounts related to public health. So since you all have had a year of this, what advice would you give to someone that wants to start an Instagram account focused around public health?
The biggest one is just be real. I mean, you mentioned how we have all of these MD and yeah, it's primarily MD influencer accounts. And I mean, it really does romanticize the idea of going through med school, when I know for a fact, because I have lots of friends that have gone through it, it's not cute. There's lots of tears. There's lots of eyebrow plucking out of stress. There's lots of stress eating. It's not this beautiful thing of, I just stayed up for 14 hours studying and I might, have a stress hemorrhoid. Like, everybody's beautiful and like they look so poised, and I'm like, but that's not what med school is. Nobody ever looks back on their med school years and says, wow, yeah, I had a really luxurious time there. No, you're in hundreds of thousands of dollars worth of debt. You probably have either gained 20 pounds or lost 20 pounds, maybe both within the same week because you're stressed. Yeah, if you're going to make an Instagram account, for the love of God, please don't romanticize it. Like, be real. I mean, I would never want somebody to get into public health with this false notion in their minds of, oh, it's going to be this glamorous thing, because it's not. I mean, it's wonderful, it's rewarding, but we're not movie stars, and we're by no means like the most glamorous people on earth. So just keep it real, be honest about it.
I would say the same thing. I would say there's no harm in being imperfect and showing the boring sides of what you do. I think something that we used to do when we were in the lab together, obviously it's much different now. I'm at home, I do nothing, and Mee-A's super busy, but like a day in the life. Sorry, we used to do days in the life like all the time, and I think that like, even though it can seem really boring, I think it's really worth like showing people like, hey, look, I sat at a computer all day and I did some data entry and I cleaned some data, because that's what epidemiology is for me. And so I would say the same thing for someone who wants to start an Instagram account for public health. Don't be afraid to show like what it really is, because that's what's most valuable to people. That's what people will be the most grateful to see, is what you're actually doing, and not just like the cute picture that you took with some donuts, even though we love taking those pictures.
Yeah, I mean, and the other thing I guess I would add is just being transparent and vulnerable. Don't be afraid to be vulnerable. I am really lucky that I have a lot of really strong female coworkers that have helped me kind of grow into my own as a professional. But there are a lot of things that I still need to work on. And one of the best pieces of advice or best resources that one of my coworkers actually just shared with me is a book that's specifically tailored to women in very competitive workplaces. And it talks about how a lot of the times we jeopardize ourselves without realizing it. Instead of saying, I did this today, we'll say, oh, I only did this today, like we'll downplay our accomplishments. And so, I mean, that's something that I'm definitely working on. And that's something that I definitely plan on posting on in our Instagram, is just to show people like it's always going to be a growth mindset for me. I'm always going to work towards bettering myself, whether that means that I'm working towards a certain certification, or if I'm working towards increasing my organizational skills, or if it's something like just bettering the way that I view myself and the way that I present myself, because that's something that I struggle with a lot, is doing that and making sure that I don't say something disparaging to myself without realizing it, and so just be vulnerable and be transparent, because I don't think there's a lot of that on social media whatsoever, or even in real life. A lot of people tend to hide that.
Yeah, I completely agree. And thank you for sharing that. If I had to add one thing, like For me, I started my account after I graduated my MPH program. If I had the chance to start it while I was in my MPH, I would have done that just to show the journey and like capture like all the failures, because a lot of people that come to my profile and follow me now probably think, oh, he's successful, he's done all these things, but they haven't seen that I like got rejected from 5 jobs, never got called back from another 8, and all those different kinds of things. So I really appreciate you all talking about like really showing the real side of what is happening.
We should make a
Yes.
post. We should count all of the job applications that we never heard back from.
Let's not, because y'all, there were a lot.
A lot. Oh my God, that needs to be talked about more. Ghosting is not okay. Why do they ghost us? Why is that okay?
Yeah, it is really
I mean,
wrong.
yeah.
Yeah, awesome.
That's something we should definitely, all 3 of us should plan to do, like a joint post on our Instagram accounts
Yeah,
about
absolutely.
that. I think that would be something that would really help, because that's definitely something I've heard from a lot of people. And now, you know, working in the county, we obviously, like, contact tracing positions are pretty common right now. And we have a lot of temp employees that are working and helping us with contact tracing efforts where we live. And it's just one of those things, you know, a lot of them are just as qualified as I am. And I just so happen to be really lucky and get the full-time position before COVID really picked up. And, you know, I want to take a chance and tell them, you know, like, it's not because you didn't deserve the position. It's not because you are less qualified than me. It's honestly like 90% luck. That sounds bad, but you just have to be at the right place at the right time in order to get a job. You know, I mean, Sitara, 200 job applications that I went through, and I would call her and be like, I completed another 30 today. Nobody's calling me back. And she'd be like, well, just keep going. Eventually one will. Like, it's all about perseverance.
Well, moving you right along. So this is the Furious 5. It's going to be the Furious 5 squared because it's 2 of you all today. So it's the guests that the questions that I ask all guests. So question number 1, what advice would you give to a student trying to pursue a career in public health?
Come up with a game plan as to what your end goal career would be. It doesn't matter if it changes throughout your program, but just kind of getting a generalized idea as to why you're getting your master's degree or your PhD in public health before you start is going to help you.
I would say don't be afraid and don't be overwhelmed. Try not to let the program overwhelm you. And don't be afraid of not knowing everything. And also, at the same time, be open to experiences. Because I think if you're someone who doesn't know exactly what you want, you could find something great if you're really open and you're not afraid to do something. Like, I would say, yeah, just don't let the fear of not knowing stop you from doing anything, because you will learn and like it will be okay.
Yeah, awesome. And I'm definitely going to quote that. Number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
So I guess 2 pieces of advice. The first would be to constantly apply. I mean, you know, it was a joke a little bit, but honestly, that perseverance really paid off. I applied to my position several times, and it wasn't until maybe the 5th or 6th time that I put in an application that I got an interview and got the job. But the second thing would be, you know, after I put in that application the first 2 times and kind of got ghosted and never heard back, what I did was I used LinkedIn as a resource. I mean, we're all about social media here. Let's talk about how we can utilize it to our benefit. For me, I got a little stalkery, I'm not going to lie. I went on LinkedIn. I found the people that lived in my area that had the job that I wanted, and I saw what their qualifications were. I connected with them. I asked them if they had any advice. And I kind of tried to emulate them. You know, if somebody had a certification, or if I saw that the 5 people in the job position that I wanted all had the same certification, then I'm going to get that certification, because clearly that's something that is going to stand out to that employer. Or if they all, you know, focused on a certain thing at school, you know, maybe they all had the same global health breadth that they were working on, you know, then maybe even if I'm not in school anymore, maybe I go online and I see if there's any additional courses I can take through like Coursera or some kind of like free learning software, you know. So definitely use social media to help you get to where you want to be, either if it's through connections or through a little bit of light stalking so that you can kind of copycat some people. You know, it helps. I mean, it does. I was able to meet a lot of my coworkers virtually through LinkedIn before I ever actually met them in person. And their qualifications that they listed on LinkedIn, and me getting those same qualifications after I had been rejected, helped me get the position the 5th time around.
I would say for a PhD program, which is a little bit different than a job, in the same vein as like, you know, don't give up, keep applying, I would say don't give up on the program, even though it may get difficult and you may feel like you're not prepared, or you're not like, I guess like what I was saying earlier about imposter syndrome, you might feel like you're not enough. You're definitely enough. And then in the second piece of advice I would give is, like Mee-A said earlier with the public health program, find someone that you want to be like, find someone that has a position that you eventually want, and look at what they did to get there, and kind of map out how you can do something similar. And even if you don't end up doing what they're doing, or you don't get every, you know, experience that they got, it'll give you a kind of a map, and it'll give you a basis of what to work off of. So I would say for me, like, for example, I had a professor in grad school that as soon as I met her, I was like, oh, this is who I want to be like. This is the kind of the path I want to take. And so I talked to her about the things that she did, and I was able to say, okay, I'm going to do this, this, and this. And in doing those things, helped me build up my resume. It helped me gain skills that I didn't know I didn't have. It helped me build up my confidence. And even if I didn't end up pursuing any of those things, it gave me a lot as a person. So definitely just find someone that inspires you, and then I don't want to say try to be them, because that's never good, but try to find similar things that can give you something to work off of.
Okay, thank you. Number 3, what's something you're working on improving in your life right now?
Being more confident in the workplace.
That's what I was going to say.
I took yours. Maybe we can say it at the same time. But yeah, like being more confident in myself. And, you know, I mean, I'm very fortunate that, you know, even in the lab that I was working in with Sitara in my previous job, I just had so many smart people that I was working with, and I felt inadequate in comparison. And Sitara is very humble, and she won't admit it, but I mean, I was so threatened by her just because of how smart and put together she is. And again, she's going to be humble and she's going to negate all of those pieces of information, but yes, she's amazing, and she is, you know, a good role model for me as a person, as a friend, as a professional. And, you know, even in my current job now, I have a lot of qualified and hyper intelligent coworkers that say a lot of big words that, I'm not going to lie, I don't really know the words or what the meaning is, you know, and it makes me feel really dumb. And I have to kind of take a step back, and I really am working on it. I'm working on it through self-help books. I'm working on it through self-reflection. And I'm also, I mean, I do see a therapist regularly as just part of like my self-care. And I mean, in the times of COVID-19, that is a telehealth conference, but, you know, I do work towards just reminding myself that I'm comparable. I don't have to, I mean, that's my baby step right now. I don't want to tell anybody I'm better or that I'm the same playing field. But right now I'm working really hard on just reminding myself that I am comparable to the people that I look up to. And so that's the big thing that I'm working on right now.
So same. I'm also working on being confident. All of my life, I've been told by teachers that I know the answer. I'm just hesitant and I second guess myself. And I've always been told that and just not really thought about it and just kind of been like, oh, well, that's because I didn't really know. But I have seen it happen in real time in this PhD program. This PhD has challenged me. It has made me see that, like, I do know the answer. I just am too quiet and too shy and too unsure of myself to say it out loud. And I always kick myself because then someone else says it and I'm like, oh, well, I could have said that. And so, that's so funny that Mee-A said that, because when I met Mee-A, I thought she was the coolest, like, most confident person that I wanted to be like. I still want to be like her. That's so funny though, because I think this is just a universal experience that you look at the people around you and you're like, oh, they're so cool. They know exactly what they're doing, but nobody does. But so mine would be being confident in myself too, and just trusting myself that I do know what I'm talking about. I think something that, I don't know, maybe women experience this, I'm sure men experience this too, but just feeling like your voice matters at a table, and feeling like I feel like I kind of still talk like a young person. I don't have the most professional way of speaking. And so when I'm in a professional setting, in an academic setting with, real adults, like real like seasoned professors, I have to just trust that I do know what I'm saying, and what I'm saying matters, and they might value it. And so I should just say it and not be so scared of being wrong, because it's okay to be wrong. No one's going to be mean to you. No one's going to be like, shut up, you suck. No one's going to say that. So definitely just being confident in myself and trusting my gut when it comes to, like, the things that I know.
Thank you. Number 4, professionally, do you recommend anything?
What do I recommend professionally? Oh, heck. Professionally, I would recommend transparency. So transparency towards your coworkers, transparency towards your employer, making sure that everybody knows what you're working on, and making sure that everybody knows what you're struggling with. And so it's one thing to be able to reiterate what you're working on, but also just letting people know what you don't know. And that's something, again, that I struggle with, that I'm working with right now, is I do have all of these amazing coworkers that are working on things that I just don't know what they are. I mean, it's still a learning experience. And so I have to realize that it's better for me to ask now than have this job and have it for 10 years, and then 10 years down the road have to ask somebody and they're like, but you've been here forever. So I'm trying my best to ask people everything I can all the time. What does this mean? Even if it's a silly question or a stupid question, I'll still ask it. I mean, there are times when I'm very sleep deprived and I cannot for the life of me remember what the formula for risk ratio is. And I'll have to ask it. And it's, I mean, I know it's simple, and I know it's something that we were taught, as little public health infants, and it's something that should be, I honestly should have a tattoo of the formula by now. But it's one of those things where, you're stressed out, you're tired, you're put on the spot, and I'll be like, I just don't remember it. And most of the time I will get a positive answer out of it, like, oh my God, yeah, neither do I. Let's Google it together. And then I realize that my coworkers also don't know the risk ratio formula off the top of their head. And it's just nice. It kind of puts us on an equal playing field. It makes us all a little bit more humble if we're more transparent. So that's my advice. Just say it like it is. Have a little bit of an open mind and just say everything as you think it. Is it going to be the most politically correct way of approaching things? Probably not, but at least people will know where you stand and what you excel at and what you need help with. So
Just to add to that, it's so refreshing to see people above me be transparent and admit that they don't know something. I'm always so surprised when, like, a professor is like, oh, I don't know that, because I'm like, what? You don't know something? Me too. So I have to say, like, absolutely. But what I was going to say is I was going to go in a little bit of a different direction with that question. And I was going to say, like, professionally, find interests outside of your profession and, like, make sure you have something to do every night and on the weekends so you don't go crazy and you force yourself to have a balance. Because I think in a PhD program especially, it's very easy to literally just spend all day, all night, and all weekend working on a paper or working on your data or cleaning your data or doing something. And so I've had to, like, take a step back and just be like, okay, I have these TV shows that I like, I have these books that I like, I have these passions of mine that on the weekends I'm not gonna do work and I'm actually just gonna enjoy myself. And it makes life so much more, like, bearable, and it makes at least for me, makes the PhD program more fun because I actually have separated it and it's not my entire life, and I get to be like, oh, now I get to work on this, but now is the time for watching a true crime documentary. So
yes,
I would say
I love that. I love that suggestion so much. That's something I actually need. I need to follow that. I'm going to take that suggestion. I'm going to do it tomorrow, Sitara. I'm going to do it tomorrow.
Yeah. So professionally, find something not professional to do in your life.
Thank you. Look at you changing lives so quickly. So last but not least, where can people connect with both of you?
Our Instagram account at donuts_data.
Instagram. We have Twitter accounts, not for Donuts and Data, but we each have our own individual Twitter accounts, and we're both on LinkedIn. So yeah, I mean, you guys can search up our names and we're pretty easy to find, I think, right? I mean, we both have unique names.
Pretty unique names, yeah. There's pretty much only one of both of us in the entire country, yes. So.
Okay, awesome. And I'll be sure to put all of that in the show notes. So thank you so much for joining me on the show. I really enjoyed this conversation, and I'm sure our the listeners will too. So I just really appreciate you, and thank you for your time, and I look forward to continuing to follow your journey.
Thank you so much for having us.
I had so much fun. This was therapeutic.
This was therapeutic. This is what I needed.
I'm really happy to hear that.
Thank you.
Yeah, definitely my pleasure.
Thank you for having us.
Yeah, and I hope to have you on in the future when your careers unfold a little bit more. So thank you, and I will talk to you all soon. I'm glad if you stuck around this long to listen to the entire episode. I'm sure that you got some part of value from this episode, because there's so much value and so much realness in this episode, and I really enjoyed that. And if you think so too, definitely go ahead and follow them on Instagram or go to the show notes and check out some more information. But they are two amazing women in public health, and I'm just really glad that they're showcasing their journeys and being real on Instagram so public health really gets out there. And yeah, so definitely. So if you haven't as yet, definitely subscribe, review, like, comment, share this with a friend, and I really appreciate you listening. And without further ado, well, I guess no, Public Health Millennial out.